मैं आरुषि नेगी इंटरनेशनल पेशेंट्स यूनियन से आप सभी का डॉक्टर आर में स्वागत करती हूँ। इंटरनेशनल पेशेंट्स यूनियन डिजिटल हेल्थ एसोसिएट्स का एक स्ट्रेटेजिक बिजनेस यूनिट है जो पेशेंट्स को देश भर के टॉप डॉक्टर्स, पॉलिसी मेकर्स, रेगुलेटर्स, इंडस्ट्री लीडर्स और फेलो पेशेंट्स से कनेक्ट करता है। इंटरनेशनल पेशेंट्स यूनियन का विश्वास पेशेंट्स को सशक्त करने में है। इसलिए पेशेंट्स यूनियन ऐप जो एंड्रॉइड और आईफोन दोनों प्लेटफॉर्म्स पर उपलब्ध है, काफी विशेष फीचर्स के साथ आती है। आप अपने जैसे कई पेशेंट्स और केयरगिवर से जुड़कर एक दूसरे से सीख सकते हैं। अपनी बीमारी को कैसे अच्छे से मैनेज करना है ये सीख सकते हैं। आप ऐप पर हॉस्पिटल्स, हेल्थ केयर प्रोवाइडर्स और गवर्नमेंट स्कीम्स को भी रेट कर सकते हैं। आप पेशेंट्स यूनियन ऐप पर ऑथेंटिक रिसोर्सेज और सरकारी स्कीम्स की जानकारी भी प्राप्त कर सकते हैं। आईपीओ ऐप पर 34 डिजीज स्पेसिफिक कम्युनिटीज है और इनमें आप अपना अनुभव बांट सकते हैं। ये ऐप पूरा वॉइस इनेबल्ड है और इसमें 16 से ज्यादा भाषाएं उपलब्ध हैं। आपकी प्राइवेसी के लिए आप अपने पोस्ट अनोनिमस तरीके से भी लिख सकते हैं। आप पोल्स में हिस्सा लेकर पॉलिसी मेकिंग में भी योगदान दे सकते हैं। हमारे ऐप में काफी नए फीचर्स हैं, जैसे कि चैटबॉट जो आपको हेल्थ की एडवाइस देता है, लिस्ट ऑफ डिजीज, लिस्ट ऑफ मेडिसिन, एडीआर रिपोर्टिंग, सिम्टम्स से स्पेशलिस्ट की जानकारी, जैसे कई फीचर्स। हमारी कोशिश है कि हम आप तक टॉप डॉक्टर्स को लेकर आए जो आपको सवालों का जवाब सरल भाषा में दें। मैं आप सभी का स्वागत करती हूं डॉक्टर आर में, जो कि एक लाइव सेशन है जहां एक प्रसिद्ध मेडिकल प्रोफेशनल आपके हेल्थ रिलेटेड सवालों का रियल टाइम में जवाब देते हैं। The topic of today's Dr. R, modifying lifestyle for cancer prevention, is deeply relevant. As we know, lifestyle related risk factors contribute to a significant proportion of cancer cases. But the good news is many of these factors are within our control. Through this session, we aim to understand how simply lifestyle changes can reduce our risk of developing cancer. Today, for the Dr. R, we have with us one of India's most distinguished oncologists, Professor Dr. Raghunadharao Digumarti, Professor and Head of Medical Oncology at MNJ Institute of Oncology and Regional Cancer Center, Hyderabad. With over 4 decades of pioneering contribution to cancer research, clinical care, and public health, Sir is not only a leading clinician but also a visionary educator and a digital health advocate. He had led several first-of-its-kind initiatives in India, including founding the Homi Baba Cancer Hospital and Research Center in Visakhapatnam under the aegis of Tata Memorial Hospital, Mumbai, establishing India's first population-based cancer registry in Hyderabad, and first hospital-based registry in Andhra Pradesh, serving as the national coordinator for training doctors in cancer screening and prevention. He has also led over 80 clinical trials and received the prestigious Dr. B.C. Roy National Award for Excellence in Oncology. We welcome you, sir.
Thank you.
Sir will be sharing insights from his experience during his presentation. Following that, we'll have a live question and answer session. As we begin the Dr. R, I would like to encourage you all participants to make the most of this opportunity and share any health-related questions in the Q&A box. Whether you're seeking clarity on a specific condition or looking for expert advice, this is the perfect time to ask. So with that, let's begin the session. Thank you once again, sir, for being with us today. We look forward to your presentation. Over to you, sir.
Okay. तो गुड इवनिंग एवरीवन। आज जो लेक्चर मैं देने जा रहा हूँ ये पेशेंट के बगैर जो भी स्वस्थ अभी है और स्वस्थ रहना चाहते हैं और बीमारी से बचना चाहते हैं उनके लिए बहुत अच्छा है। लाइफस्टाइल डिसऑर्डर माने क्या है पहले जान सकेंगे। यानी कि जैसे कि आपको स्थूलकाय हो सकता है, ओबेसिटी हो सकता है, ओवरवेट हो सकता है, जैसे कि आप स्मोकिंग करते हैं, धूम्रपान लेते हैं या दारू पीते हैं या कुछ अन्य तरह के आपके लाइफस्टाइल में है जो मैं बताने जा रहा हूं, उनकी वजह से आपको बीमारियां हो सकते हैं, उनको लाइफस्टाइल डिसऑर्डर्स कहा जाता है। इन्हीं में आएंगे बहुत सारे बीमारियां, बट 5 तो हमें जानना चाहिए, क्योंकि जैसे कि एक कंट्री में, मुल्क में इन्फेक्शस डिसीजेस और माल न्यूट्रिशन कम होता जाएगा, यानी कि न्यूट्रिशन इम्प्रूव होता जाएगा, और जो भी बीमारियां पानी से फैलते हैं जैसे कि टाइफाइड फीवर, कॉलरा एट्सेट्रा, वो कम होते जाएंगी। जैसे कि बीमारियां उनके लिए जिनको टीका है उनसे हम निवारण कर सकते हैं। वो कम होते जाएंगे तो हमारी जो बीमारियां बचेंगे और जो हमारे साथ चलने लगेंगे वो होंगे हाइपरटेंशन, हार्ट डिसीज, डायबिटीज, सीओपीडी और कैंसर। सो ये पांचों को लाइफस्टाइल डिसऑर्डर्स कहा जाता है। ये पांचों में कुछ चीजें ऐसे हैं कि पांचों के कारण और पांचों के निवारण भी एक ही है, एक ही मतलब में चल सकता है। यानी कि जो भी लाइफस्टाइल डिसऑर्डर्स हो सकते हैं उनमें ये पांच में से एक या दो या तीन आ सकते हैं। यानी कि जिनको डायबिटीज हो, जिनको ओबेसिटी हो, जिनको हाइपरटेंशन हो, जिनको हार्ट डिजीज हो और सीओपीडी हो, और जो अलग किस्म के लाइफस्टाइल के बारे में है उनको भी कैंसर होने की संभावना बहुत ज़्यादा है। तो आज हम जानना आपको मैं ये बताना चाहूँगा कि आप इनका निवारण कैसा कर सकते हैं। मैंने तो कैंसर के बारे में बताया, मगर यही लाइफस्टाइल चेंजेस बाकी चार अ, बीमारियों को भी रोक सकता है, यानी कि निवारण कर सकता है। तो पहले ये जानना चाहना चाहिए कि कैंसर क्या होता है। इमेजिन आपको एक छोटा सा चोट लगा है और वो चोट में से थोड़ा खून निकला है, आपने उसको क्लीन करके ड्रेसिंग करने जा रहे हैं। तो चारों ओर से ये जो कट लगा हुआ है वहां से चारों ओर से अपने स्किन सेल्स अपने आगे बढ़ते जाएंगे और जहां दोनों मिलेंगे वहां रुकावट हो जाएगा, यानी कि भर्ती हो गया। जो गैप था कट की वजह से, चोट की वजह से, वो जब भर्ती हो जाता है, फिलअप हो जाता है, तो सेल डिवीजन रुक जाता है। सिमिलरली यू इमेजिन एक माँ की गर्भ में एक बच्चा पैदा होने लगा है। तो नॉर्मली एक औरत की यूट्रस अपने मुट्ठी भर की होती है। ओके, इट इज जस्ट द साइज ऑफ अ फिस्ट। अब जब जैसे कि बच्चे बढ़ता जाता है, वो 3 किलो 4 किलो होता है, उसके साथ प्लेसेंटा होता है, उसके साथ कुछ फ्लूइड्स होते हैं, मेम्ब्रेन्स होते हैं। वो सबको अकोमोडेट करने के लिए दिस यूट्रस ग्रोस टू द साइज ऑफ ए 6 or 8 किलोग्राम मास। जो मुट्ठी भर की थी, that is about 15 to 20 grams, it becomes kilogram size. So there is some purpose for that cell division। ये सब सेल डिवीजन से होता है जो यूट्रस बढ़ता है। और बच्चा का जन्म हो जाने के बाद, आफ्टर द डिलीवरी इज ओवर, विथिन ए फ्यू वीक्स फिर वो यूट्रस अपना फिस्ट साइज तक आ जाता है। दैट मीन्स इट इज रेगुलेटेड। जैसा कि बच्चे को अंदर ग्रो होने के लिए यूट्रस बहुत बड़ा हो गया है, और बच्चे का जन्म हो जाने के बाद आफ्टर बर्थ इट हैज रिग्रेस टू ए स्मॉल साइज, अगेन टू द सेम साइज एज इट वाज ओरिजिनली। सिमिलरली विद द ब्रेस्ट, एवरी मेंस्ट्रुएशन साइकिल से जब ओवम रिलीज होता है, इट इंक्रीजेस इन साइज, and then when there is no implantation, yani ki it is not fertilized, and there is no baby growing inside the uterus, the breast will regress. So irregularly chalta jata hai with each cycle. So there is some purpose and it is very well regulated। हर महीना ऋतु कैसा होता है उतना वैसा ही it is regulated। So cancer can be viewed as purposeless unregulated cell division। It did not stop there। इन्वेशन ऑफ एडजेसेंट ऑर्गन, जैसा यूट्रस बढ़ रहा है, इट इज नॉट गोइंग इनटू यूटर, इट इज नॉट गोइंग टू ब्लैडर, इट इज नॉट गोइंग टू इंटेस्टाइन, इट इज गोइंग नॉट गोइंग टू स्पाइन, इट इज नॉट गोइंग टू एब्डोमिनल वॉल, it is still confined to the uterus only। Here the cancer will start spreading to the जो भी आजू बाजू में है उनको खाने लगता है. So it eats up. So it uses that as fuel, makes space, and then grows. उतना ही नहीं, वहां से दूर दूर फैलता जाता है. दैट मीन्स ये कैंसर विच स्टार्ट्स इन से लार्ज टो, आपका पैर में शुरू हुआ, it can spread to the glands in the groin. From there it can spread to the lungs. From there it can spread to the liver, it can spread to the bone, it can spread to the brain. So हर जगह पे फैल सकता है. So there are four different aspects for cancer. One, it is purposeless. Two, it is unregulated. Three, it is not obeying any laws of cell division. Three, it invades adjacent organs. Four, it metastasizes. That means दूर दूर तक फैलता है. And that is the reason why it kills, because it reaches very critical organs. So it is purposeless, unregulated, invasive, and metastatic. Now, I am telling you only in brief what is the cause for cancer. बहुत सारे physical agents, ionizing radiation बोलते हैं, not the cell phone radiation, not the radio radiation, not the microwave radiation, not the Bluetooth radiation. That is not called radiation. Radiation, by radiation we mean whatever can ionize a substance, ionize a gas, ionize an element, यानी कि उसको पॉजिटिव आयन या नेगेटिव आयन तक बदलता है. दैट इज कॉल्ड एन आयनाइजिंग रेडिएशन. उससे हो सकता है. कैन अकर फ्रॉम कांस्टेंट फ्रिक्शन और कांस्टेंट हीटिंग. जैसे कि यू माइट हैव हर्ड ऑफ कंगड़ी. कंगड़ी इज ए pot full of live coals, and to keep themselves very warm in Kashmir, they keep it next to the tummy. कंगड़ी पहन के उसके बाद they will wear the clothes so that they stay warm. वहां पे कैंसर हो सकता है. जैसे कि you have a sharp tooth rubbing against your lip or against your cheek, वो भी it is a physical friction, उससे भी कैंसर हो सकता है. Okay. And of course from we can have radiation from a CT scan, you can have a radiation from fluoroscopy, you can have radiation from an angiography, many other radiations. बहुत सारे केमिकल्स हैं जिससे कैंसर हो सकता है. So you name it, that chemical may be possible to cause cancer. Of course all these are divided into definitive, that means जो humans में definitely they cause cancer, which is probable, and so there is some element that it causes cancer in lower animals like rodents, and then we are not very sure whether it causes definitely or not in human beings. Then plausible, yes, it can cause there is some evidence that it can cause in lower animals. It is not definitive, but it can cause, and definitely it is non-carcinogenic. So we divide International Agency for Research Against Cancer divides them into 4 groups. So chemical agents can. Biological agents, yes, several viruses can cause cancer. जैसे कि एप्स्टीन बार वायरस है जो हॉजकिंस लिम्फोमा काज करता है, नासोफेरेंजियल कैंसर काज कर सकता है, लिम्फोमास क्लास कर सकता है, नॉन हॉजकिंस लिम्फोमा भी करता है. HTLV 1, 2 and 3 बोलते हैं, टी लिम्फोट्रॉपिक वायरस बोलते हैं, उससे बहुत सारे लिम्फोमास आते हैं. HSV 1 and 2 उससे भी हो सकता है. And then we know that hepatitis B and C viruses उन वायरसों से भी हो सकता है. ह्यूमन पैपिलोमा वायरस, उनसे 6 किस्म के कैंसर हो सकते हैं. Not just in women as many people think, but also in men also. I will come back to that. And so HIV indirectly कैंसर काज कर सकता है क्योंकि वो इम्यूनिटी को दबाता है. शरीर में अपने आप जो भी ताकत है बीमारियां रोकने की, कैंसर को ढूंढ के उसको खत्म करने की, उसको मिटा देता है. तो बायोलॉजिकल एजेंट्स आल्सो कैन कॉज कैंसर. बहुत सारे एनवायरमेंटल कॉजेस हैं जो कुछ हमें पता है, कुछ हमें पता नहीं है. जैसे कि हेवी मेटल्स है, आर्सेनिक है, मर्क्यूरी है, क्रोमियम है, उनसे कैंसर हो सकता है। जैसे कि एस्बेस्टास है, एस्बेस्टास से मेसोथेलियमा करके कैंसर हो सकता है। दे आर ऑल एनवायरमेंटल एजेंट्स। एंड आई टोल्ड यू, फेल्यूर ऑफ बॉडीज इम्यून सर्वेलेंस सिस्टम, शरीर में कुछ वाइट ब्लड सेल्स ऐसे हैं जो कैंसर को ढूंढ के उनको खत्म कर सकता है। वो अगर फेल्यूर आया तो किसी भी कारण, वेदर इट इज फ्रॉम ट्रीटमेंट फॉर अनदर डिसीज और इनहेरेंटली, उनमें भी कैंसर आने की संभावना है। तो ये जो हमने सुना है, ये 5 कैसे करते हैं, क्या करते हैं कण में जो कैंसर लायक होए। तो ऐसा है कि we need to understand that this is important, that we understand what do these cells do to the cell, what do these agents do to the cell. तो ऐसा मालूम कर लीजिए कि हर कण में देयर इज ए सेंट्रल एरिया कॉल्ड न्यूक्लियस, जिनमें क्रोमोसोम्स हैं, जिनमें कुछ जीन्स है जो सेल डिवीजन के लिए दे आर इन कंट्रोलिंग द सेल डिवीजन, यानी कि एक कण विभाजन होना है ना होना है, इसको कंट्रोल करते हैं। इसको दे आर कॉल्ड कार्डिनल जीन्स रेस्पॉन्सिबल जेनेटिक फिट, जेनेटिक फिटिलिटी, यानी कि सेल डिवाइड होने से पहले ये चेकलिस्ट लगाता है कि जो आपकी माता से गर्भ से आए हैं वही जेनेटिक मटेरियल आप कैरी कर रहे हैं, कुछ बदलावट आया है, बदलावट आया तो इट विल टेल द सेल go, you can commit suicide, you cannot enter cell division. तो सो आफ्टर टिपिकली ऐसा जीन को कंट्रोल करता है कैंसर। सो फर्स्ट दे विल डिसेबल द गेट कीपर जीन, समझ लिया ना, तो वो उसको निकाल दिया। आफ्टर दे रिमूव द गेट कीपर जीन्स फॉर जेनेटिक फिडिलिटी, देन दे एंटर परपेचुअल सेल डिविजन, यानी कि वैसा कि लगातार सेल्स डिवाइड होते जाते हैं। देन दे कैन रिक्रूट बॉडीज मशीनरी कि मुझे खून लाओ, मुझे ऑक्सीजन लाओ, मुझे खाना लाओ, and they will start building all that machinery. That means they can grow blood vessels, they can grow break bone into small cavities, जैसे कि चिड़िया एक घोंसला बना रहा है, they will make a small nest and start going there, growing there. And of course this can happen without the genes being involved also, that is called epigenetic mechanism. And most importantly ये 5वां जो है that is important, जो एक सम्मोहनास्त्र डाल के इम्यून सिस्टम को उसको सिला देते हैं। दे विल मेक इट स्लीप, गो टू स्लीप, हमारे बारे में सोचना बंद कर दो, ठीक है। दिस इज इंपॉर्टेंट टू अंडरस्टैंड। Now I will come back to what I intended to talk today. Lifestyle can increase our risk of cancer. So I'm not saying that if you follow this you will never get cancer, but your chances of getting a cancer will drop down dramatically. This is proven. So I'm not talking out of fiction. This is not WhatsApp University. This is not Google. Okay, so these are tips to reduce the risk of getting a cancer. First and foremost, do not use tobacco in any form. तंबाकू को किसी भी फॉर्म में, वो बीड़ी हो, वो सिगार हो, सिगरेट हो, खैनी हो, जर्दा हो, हुक्का हो, कोई भी मतलब नहीं है। डोंट, और पेस्ट हो, गुजरात में पेस्ट यूज करते हैं लेडीज, इट इज लाइक ए टूथपेस्ट, उसमें से थोड़ा लेते हैं, वो अपना पर्स में रख के दे विल रब इट अगेंस्ट द गम, इट इज जस्ट लाइक ए सिंपल टूथपेस्ट, ठीक है। तो इट इज इंपॉर्टेंट टू अंडरस्टैंड दैट टोबैको इन एनी फॉर्म कैन कॉज कैंसर। यहाँ लगाया वहां भी हो सकता है, और जो इट इज गोइंग इनटू द लंग्स, इट इज गोइंग इनटू द नोज, जैसे कि अपना इफ यू आर टेकिंग इट एज लाइक स्नफ, कैन कॉज कैंसर ऑफ द लंग, माउथ, थ्रोट, लैरिंग्स, पैंक्रियास, दूर दूर तक करता है, क्योंकि वॉट एवर इज द हार्मफुल सब्सटेंस उसको कार्सिनोजन बोलते हैं। वो आप जो इनहेल कर रहे हैं वो स्मोक से इट विल एंटर द लंग्स, फ्रॉम देयर इट विल एंटर द ब्लड एंड इट विल कॉज कैंसर फार अवे, पैंक्रियास में, ब्लैडर में, सर्विक्स में, किडनी में भी कैंसर कॉज सकता है। एंड ऑफ कोर्स इफ यू आर चूइंग, इट कॉजेस कैंसर ऑफ द ओरल कैविटी। ये सेकंड हैंड स्मोक जो है, आप स्मोकर ना होवे फिर भी आपको कैंसर होने की संभावना है। इफ पीपल अराउंड यू, जैसे कि आपकी चाचा जी सिगरेट पी रहे हैं, नाना जी सिगरेट पी रहे हैं, मामा जी सिगरेट पी रहे हैं, ओके, यू आर इन द फैमिली, और योर फादर इज स्मोकिंग, और एट वर्क प्लेस आप नॉन स्मोकर हैं बट ऑल द अदर 5 or 6 मेंबर्स इन द वर्क प्लेस आर स्मोकिंग, उनको तो एक ही 1 पोर्शन ही आ रहा है, मगर इफ यू आर अमंग 6 people हु आर स्मोकिंग, यू आर गेटिंग 6 times द कार्सिनोजन, दैट मीन्स 6 times द स्मोक यू आर गेटिंग, यानी कि जो दम लेता है दम के बीच में रोकता है ना, सो ही विल इनहेल, कीप द सिगरेट इन द हैंड, और एट दैट टाइम आल्सो देयर इज स्मोक कमिंग आउट, ओके, वो स्मोक जो निकल रहा है सिगरेट से या हुक्का से, उससे भी कैंसर हो सकता है। दिस इज कॉल्ड सेकंड हैंड स्मोक। शी इज नॉट स्मोकिंग, शी इज वेरी यंग, शी इज एक्सपोज्ड एट ए वेरी यंग एज, एंड सी ऑल ऑफ देम आर स्मोकिंग, सो शी कैन गेट। ये जो नीचे लगाया मैं, ये थर्ड हैंड स्मोक हो सकता है। तो थर्ड हैंड स्मोक क्या होता है? थर्ड हैंड स्मोक में ये पिताजी स्मोक कर रहे हैं, और बच्चे को सेकंड हैंड स्मोक मिल रहा है, और ये जो माता है, माता के गर्भ में एक शिशु है, तो यहाँ से जो हस्बैंड स्मोक कर रहा है, शी इज इनहेलिंग, दैट इज सेकंड हैंड स्मोक, और जो बच्चा है अंदर पेट के अंदर, उसको जो स्मोक मिल रहा है वो है थर्ड हैंड स्मोक। दिस इज कॉल्ड, यानी कि स्मोक का एक्सपोजर, इट इज नॉट नेसेसरी कि आप 16 साल के बाद किसी विलन या हीरो को इमिटेट करें सिनेमा में एक सिगरेट पीने की, वो नहीं है। इट स्टार्ट्स इवन बिफोर यू आर बॉर्न, सो दिस इज कॉल्ड थर्ड हैंड स्मोक, इवन दैट कैन कॉज कैंसर। सो ये है चार्ट जो ब्रिटिश आयल्स वाले बनाया, तो ये दिखा रहा है the bigger the red dot, the greater the risk of cancer। तो ये बहुत सारे बड़ा है, वो लंग कैंसर करता है। उसके बाद देखिए ये ब्लैडर कैंसर बहुत दूर है, फेफड़ों के पास नहीं है, नीचे है, फिर भी ब्लैडर कैंसर आ रहा है। बाउल कैंसर, पैंक्रियाटिक कैंसर, किडनी, स्टमक, लिवर, अपर एरोडाइजेस्टेड, यानी कि नोज, नेसल साइनसेस, माउथ, अपर थ्रोट, लैरिंग्स, ईसोफेगस, और ये देखिए खून का कैंसर भी होने की संभावना है। तो आप अगर स्मोकिंग या टोबैको बंद कर दिया तो 15 डिफरेंट टाइप्स ऑफ कैंसर्स को रोक सकते हैं। तंबाकू का यूज बंद कर दीजिएगा। ये जो स्मोकलेस टोबैको हो, हम स्मोक नहीं करते हैं, दीज आर माय ओन पेशेंट्स, हम अपना लाइफलाइन को निकाल देते हैं, जैसे कि आप रब करते हैं छूने के साथ तंबाकू को, एक छोटा सा बूंद जैसे लगा के, मोती जैसा लगा के यहाँ पे लगाते हैं ना, वो जो लगाया वो इरेजिंग इज लाइफ लाइन। एट द सेम टाइम जहाँ पे लगाया चूना तंबाकू का मिश्रण, वहां पे कैंसर होने की संभावना है। यहाँ पे ये जबान पे हो रहा है, ये होंठों पे हो रहा है, जहाँ दोनों जगह पे कैंसर होने की संभावना है। और नॉर्थ कोस्टल आंध्रा में तो वो सिगरेट को अंदर लगा के, यानी कि लाइटेड एंड को अंदर लगा के उसको पीते हैं, उससे भी हार्ट पैलेट में होने की संभावना ये है। ये दोनों देखिए, ये कैंसर है, हार्ट पैलेट में होता है। जगह ये सिर्फ एक जियोग्राफिकल एरिया, नॉर्थ कोस्टल आंध्र प्रदेश, श्रीकाकुलम, विजयनगरम, विशाखापट्टनम, और वहां से थोड़ा गंजाम डिस्ट्रिक्ट ऑफ उड़ीसा में भी है, वहां पे होता है। और बहुत सारे आजकल तो ये फैशन हो गया औरतों में और लड़कों में कि हम स्मोक नहीं करेंगे, ना तंबाकू खाएंगे, मगर हम हुक्का पिएंगे। ये देखिएगा कितना हानिकार है हुक्का। एक टिपिकल सिगरेट सेशन 5 या 7 मिनट होता है। एक 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 सेशन जो हुक्का का है 20 से 80 मिनट होता है। एक टिपिकल सिगरेट में जो सिगरेट पीता है वो 8 या 12 पफ लेते हैं, यहाँ 20 या 200 पफ लेते हैं, क्योंकि उससे वो निकोटीन जो आना है उसको मिलाने के लिए, अंदर लाने के लिए। ये 40 to 75 ml पर स्मोक पफ होता है। यहाँ देखिए 150 ml to 1000 ml पर पफ होता है, यानी कि एक साथ आप 100 या मोर सिगरेट्स पिएंगे। यहाँ एक सिगरेट पिया यहाँ एक हुक्का को आप हुक्का सेशन, हुक्का पार्लर में हैदराबाद में बहुत सारे हुक्का पार्लर है, वहां जाएंगे तो 100 सिगरेट्स लिया हुआ मालूम पड़ता है, स्मोकिंग को छोड़ देंगे। नेक्स्ट, ईट ए हेल्दी डाइट। ये हेल्दी डाइट क्या होता है ये देखना चाहेंगे। प्लेंटी ऑफ फ्रूट्स एंड वेजिटेबल्स, यानी कि वॉट एवर इज अवेलेबल फ्रॉम द प्लांट किंगडम, try to take them as much as possible. And obi, that it should be green whole grains and beans which are legumes, उनको खाने से you can prevent cancer. लिमिट प्रोसेस्ड मीट। फ्रेश मीट अच्छा है, जैसे चिकन खाया आपने, फिश खाया, अंडा खाया, मीट खाया, दिस इज नॉन अनप्रोसेस्ड फूड। आप वहां गया, वहां से सीधा लाया, यू कुकड एंड ईट, दैट इज वंडरफुल। प्रोसेस मीट का क्या होता है, ये सॉसेज, जैसे कि वेस्ट को हम एप करना चाहेंगे, यू स्टार्ट ईटिंग ए बन विथ सॉसेज, ओके, एक हॉट डॉग बोलते हैं ना, एक सॉसेज, एक सलामी, that is also a processed meat. Okay, anything which is preserved and then eaten can cause a cancer. So processed meat can increase risk of certain types of cancers. So यहाँ मैंने junk food versus healthy food लिखा। जो भी you think is very tasty, all the foods which are very tasty can cause cancer. All the foods which are typically bland and children will refuse are the most protective against cancer. यहाँ मैंने दिया प्रोसेस्ड मीट्स, कुकीज, हॉट डॉग्स, फ्रेंच फ्राई, डोनट्स, चिप्स, बेकन is again a processed and stored food, crackers, leaf greeny vegetables, cauliflowers, turmeric, okay, broccoli, okay, and then tomatoes and garlic, you may know already, noni also. These are very protective against cancer. Third tip, maintain a healthy weight and be physically active. यानी कि you are a man or a woman and you belong to which area, यानी कि you are in Europe, you are in Asia, you are in North America, you are belonging to an Asian race, you are belong to a white race, you are belong to a Hispanic race, or you are an American Indian, or you are a Japanese or a Korean. According to your height and your age and your race, height, age and race, and of course a fourth one called frame, small frame, medium frame, large frame. इसके मुताबिक you should be having your weight. So it reduces the risk of breast, uterus and colon cancer. We already know breast, uterus and colon cancer are very high in those who are overweight and obese. तो इसके लिए क्या करना है, फिजिकली एक्टिव रहना, यानी खाना खाने के सोने से कोई फायदा नहीं। You need to have some moderate physical activity, 75 minutes a week of vigorous aerobic activity, or moderately double that, 150 minutes a week of moderate activity. ठीक है, यानी कि roughly you can calculate it as 40 minutes a day, okay, is supposed to be the best. 30 minutes of physical activity in your daily routine. If you can do more, even better. तो ओबेसिटी से जो भी हो सकता है, eat lighter and leaner by choosing fewer high calorie foods. जो जिसमें भी शुगर है, शुगर को कम कर लीजिए. There is now a sugar tax proposed in the US. It's already in place. A sugar tax is proposed in India also. So anything which contains refined sugar and fat from animal sources, जैसे कि lard हो, जैसे कि whatever is the fat source from animal, that is to be discarded. Okay, that can definitely promote what is called inflammation, and from there you get cancer. So how to calculate? This is, I've given it for a woman. So you calculate your body mass index. It is in metrics. You can do it. Weight in your kilogram. You take your height and then square it. So divide your weight in kilograms by height squared. ठीक है? Or you want to calculate in the British weight in pounds, height in inches squared into 703. And this is a table which tells you whether you are overweight or underweight. ठीक है? So This is the normal. Up to 25, 24.9 is supposed to be normal weight. You should not be underweight. You should not be overweight or obese. And many cancers are caused by being overweight. इसमें instead of those pink dots, I have written it in big letters. जो भी big letters में है, यानी कि uterus cancer, bowel cancer, breast cancer, they are very high in those people who are obese. Likewise, gallbladder, liver, pancreas, kidney, esophagus, and other cancers can also be caused. That means prostate and ovarian cancer. So it is important that if you regulate your weight through physical activity, okay, you can cut down the risk of your cancer for 10 cancers. Next, जो भी हम बहुत चाहते हैं, avoid alcohol in all forms. So alcohol plus cigarette smoking is not 1 + 1 is 2, it becomes 4. So alcohol is very helpful in dissolving all the carcinogens, that means cancer causing agents in cigarette smoke or tobacco, and taking it in your body. So it is important to understand alcohol is one of the best sources for carcinogens, not by itself, because of other things. So इसमें जो दिया है, so alcohol drinking caused nearly 7,000 cancers in Canada in the year 2020. And breast cancer made up almost 1 in 4 of the new cases attributable to alcohol. It is becoming fashionable for women to drink cancer, at least in Bengaluru, all the metros. More bars are more crowded with women drinking and smoking. So it is important to understand that alcohol can increase the risk of cancer. Here, colon cancer, rectal cancer, oral cancer, liver cancer, etc. And of course, breast cancer, 24%. So I have picturized here again as pink drops, pink blobs, so that you understand bowel, breast cancers are very phenomenally high if you drink alcohol. So if you are addicted to alcohol and you can't control alcohol, then you should restrict the amount of alcohol. So as a prevention, not drinking alcohol is the best. But if you do drink alcohol, कि आपको पीना ही पड़ रहा है, limit to standard drinks. ये standard drink क्या है लिखा है, एक beer can, okay, 7% alcohol है, malt 8 to 9% fluid ounces. That means 8 fluid ounces of table wine or 1.5 ml of a shot of 80 proof यानी कि whiskey, etc. ठीक है, this is important to understand. Next, पांचवा, practice safe sex, यानी कि it is important to remain committed to one single man or woman. Okay, this is important. So binary is important. So the opposite gender is very safe. Or if you restrict yourself to one person, आप औरत हो या आदमी हो, doesn't make any difference. Promiscuity should be avoided. Promiscuity leads to an increased risk of these viruses: hepatitis C virus, hepatitis B, human immunodeficiency virus, and HPV virus. Most important. It is unbelievably important to know about HPV. I will come back to that. तो इसके साथ भी रिस्की बिहेवियर के साथ ये भी चलता है, that means drugs लेना. Drugs suppress the immunity of the human being. white blood cells को कम करते हैं, वो सम्मोहनास्त्र डालते हैं, एडिक्शन लायबल ड्रग्स बोलते हैं. And of course you share needles. पहले you will start snorting it, then you will start boiling it, and then injecting it into your vein, and that leads to all sorts of viral infections. If you are very fair colored, you don't have a black pigment like I have, then the sun is a major source for your, I told you, physical ionizing radiation आता है, ultraviolet rays भी आते हैं, ionizing radiation, इसमें ultraviolet rays are the most important. Light skin is prone for skin cancer, which is a preventable cancer. So दोपहर के 12 बजे बस धूप में जाना अनुचित है. Stay in the shade, sunglasses and a broad brimmed hat. Wear a sunscreen if you have to go into the sun. And don't go for those which promote tanning and sun lamps. They will definitely cause skin cancer, 100% proven. Most important. 7th and 8th are the most important. जैसे कि आप 35-45 years आने के बाद you will say, I want to be screened for diabetes, hypertension, heart disease, etc. You should have a regular, whenever you go to a doctor, you must ask, डॉक्टर साहब ये इसके लिए भी मुझे स्क्रीन कर दीजिएगा स्किन कैंसर इफ यू आर फेयर स्किन्ड नॉट लाइक मी रेक्टल कैंसर सर्वाइकल कैंसर ब्रेस्ट कैंसर ओरल कैंसर भी उसको भी कैंसर so 1 in 3 cancers deaths can be prevented earlier with earlier detection यानी कि if they examine they can pick up the cancer early and then they can save your life. So cancer screening certainly saves lives. It is called a secondary prevention aspect. So in India 3 cancers are preventable: oral cancer, cervical cancer and breast cancer. So तीनों के लिए there are screening tests available. So breast cancer can be detected by a mammogram in a woman. In a woman, again, you can take a smear and check it for either a pap smear, or you can do a via villi, or you can do directly a human papilloma virus in that smear. And oral cancer में मुंह को एक फोटो लिया जाता है and it will be studied very well and we actually feel finger की मदद से gloved finger की मदद से we can feel if there is any thickened spot in the mouth. Last but not the least, you should get vaccinated. Hepatitis B तो आपको it is part of universal vaccination now. So it will be given to all children before they start schooling. A booster dose is given in the second decade. That means 11th, 12th, 13th year पे एक booster dose दिया जाता है when they leave school and enter into a junior college. So that is enough. If you are a healthcare worker, of course, every 5 years you have to do a hepatitis B antibody titer and take an additional booster if you need it. It reduces the risk of liver cancer. It is included in universal vaccination. अब 2023 में तो मोदी साहब ने ह्यूमन पैपिलोमा वायरस के लिए वैक्सीन दिलाऊंगा करके बताया था, but he did not do it. He asked the state to start the program, but many have not started. Delhi, Haryana, Sikkim, some areas of Maharashtra, some areas in Gujarat, Pondicherry, Assam, they have started the program. Papilloma virus are many cancers करते हैं. It is recommended for both boys and girls, not for girls alone. That is a political statement. Between the ages of 9 and 14, you can actually vaccinate all the way up to 26 with 3 doses if you are still unmarried. So this is one vaccine with just 2 doses before 14 years, which prevents 6 cancers. औरत में तो cervical cancer, vaginal cancer, vulval cancer, and in men, anal cancer and penile cancer, and in both men and women, oropharyngeal cancer, यानी कि throat cancer. One single vaccine which can prevent at 2 doses 6 different types of cancers. तो आप में जो भी है, you ask your pediatrician or you ask your gynecologist or you ask your physician that your children should be given HPV vaccine. And whoever is there who is a woman in this audience, if you are above 35 years, go and have a cervical cancer screening and a breast cancer screening done. आप अगर तंबाकू खा रहे हैं या जर्दा या पान मसाला खा रहे हैं और सिगरेट या बीड़ी या हुक्का या सिगार पी रहे हैं या नस ले रहे हैं तो काइंडली आस्क फॉर स्क्रीनिंग ऑफ योर माउथ फॉर oral cancer. This is what I do when I go to villages. We adopt a village. और village में पूरे बच्चों को vaccination दिलाते हैं and we will screen every single woman in that village. It takes about 6 months to 9 months to finish that program. 3 या 4 दफा जाना पड़ता है for the 2 cancers which I have said. In North Coastal Andhra, where I work, of course, it can be oral cancer also, since women also will smoke in North Coastal Andhra Pradesh. I will stop here. As promised, I took exactly 40 minutes and I will stop sharing my screen. And if you have any questions which you would like to ask, I see some 14 Q&As here. How can individuals reduce the risk of cancer through lifestyle modification? My talk is only on that. All the whatever I have done, taken today is on modifying your lifestyle to reduce your risk of cancer. What are some specific dietary changes that can help reduce the risk of cancer? Most important, जो भी आप घर में खाना खा रहे हैं, your grandmother was making and giving you, you belong to a certain geographical area. आप एक स्टेट से पैदा हुए हैं और आपका गांव का जो भी खाना था, और ये आपको बताया दिया जाता है, ये चीज सवेरे खानी है, ये चीज दोपहर को, ये चीज रात को, ये इस दिन आप उपवास रखना चाहिए, फास्टिंग रखना चाहिए, एंड ये चीज इसी महीने में खानी है, यानी कि यू शुड ईट इट ड्यूरिंग समर। ये चीज विंटर में खानी है, तिल के जैसे चीज, तिल जैसे है, रेवड़ी है, or you will call रेवड़ी है, you eat it only in winter, you don't eat it in summer. So this is very important, यानी कि our genes have got accustomed to meeting these food substances according to the time of the year. जैसा मौसम बदलता जा रहा है, उसी के मुताबिक जो भी हमारे गांव में पैदा होते हैं, नॉट सुपरमार्केट में, सुपरमार्केट में यू विल गेट ऑल द वेजिटेबल्स, ऑल द फ्रूट्स, ऑल द मीट थ्रू आउट 24 आवर्स 365 डेज मिलते हैं। ऐसा मत खाइएगा। वन, दैट मीन्स प्लीज स्टिक टू योर देहाती डाइट। टू, आप जब माइग्रेट होते जाएंगे, यानी कि यहां से विलायत जाएंगे, विलायत से जो आपका सेकंड जनरेशन, थर्ड जनरेशन आएगा, यू शुड नॉट चेंज योर डाइट टू दैट लोकल एरिया। यानी कि नेक्स्ट दिन से एक बर्गर खाना, एक सॉसेज खाना, एक हॉट डॉग खाना, एक पिज्जा खाना, ये नामुमकिन है। दैट मीन्स चेंज इन डाइटरी हैबिट्स इज द सिंगल लार्जेस्ट रीजन फॉर गेटिंग कैंसर। ये हमने किया है। दिस स्टडी वाज डन बाय अस in colon and breast cancer in 30,000 people in India from Gujarat, vegetarians from Gujarat, those which migrated to England, first generation migrants, second and third generation migrants. So second and third generation migrants, those who have given up Gujarati khana and have become totally British, they get British type of lifestyle disorders. उनके मुताबिक ओबिसिटी होता है, उनके मुताबिक हाइपरटेंशन, हार्ट डिसीज और कैंसर भी होता है। दैट मीन्स ऑल द कैंसर पोर्टफोलियो चेंजेस, नया नया कैंसर आने शुरू होता है, विच आर कंप्लीटली रेयर इन इंडियंस। वी डोंट गेट कोलन कैंसर, you understand what I'm saying? You don't get pancreatic cancer. These are all very rare cancers in us. So वहां जाने के बाद यही शुरू होता है, नया कैंसर शुरू होता है। What are 3 simple things every person here can start doing today to reduce? 1, stop eating processed meat. 2, no alcohol and tobacco of any sort. 3, maintain your weight through physical exercise. Don't starve. You need physical exercise to keep yourself healthy. 4, 5, and 6 are simply get screened when you reach that age, ask for a test. And definitely, if you are in that age group, take the vaccine for human papillomavirus. Otherwise, you ask your children to take the vaccine. Then what can be done for fibroids during menopause? How can we prevent them? Menopause के बाद fibroids are dependent on estrogen. मेनोपास होता है यानी कि ओवरीज फेल हो रहे हैं, ओवरीज अपना काम बंद कर दिया तो ईस्ट्रोजन शुरू नहीं होगा, ईस्ट्रोजन पैदा नहीं होगा, ऑटोमेटिकली फाइब्रॉइड्स विल रिग्रेस. Fibroids is nothing related to cancer. Okay, either in the breast they are called fibroadenoma, in the uterus it is called an involutional change. जो मैंने बताया साइक्लिकली होता है ईच पीरियड से, उसमें थोड़ा गड़बड़ हुआ तो फाइब्रॉइड्स और फाइब्रोएडेनोमा आते हैं. दे डोंट लीड टू कैंसर एवर. उसके बारे में सोचना बंद कर दीजिएगा. If some doctor tells you that ये कैंसर हो सकता है, वो बताइए कि मैं डॉक्टर रघु को सुना है कैंसर होने की संभावना नहीं है बोल दिया. Can lifestyle changes still help people who already have a cancer? Yes, sir. Yes, sir. Yes, yes, and yes. अगर आप you are a obese colon cancer, pancreatic cancer patient, or you are a breast cancer patient, and you bring your weight down to the correct weight for your age and gender and your race, yes, your chances of getting back the disease fall down by 75%. If you stop smoking, if you stop drinking alcohol, for a cancer induced by alcohol and smoking or tobacco, yes, your chances of getting back the cancer dramatically fall. This is important to understand. So it is important that even if you get a cancer, all my rules will hold good. All my 8 tips will hold good. Okay. So it is never too late to change over to these. So even if you have got a cancer, you have got cured, you want to prevent it from coming back, these tips will hold good. Can lifestyle change still help people who already have a cancer diagnosis? Yes. Strong family history, even more. Yes. What are some specific diet rules and precautions for kidney cancer patients undergoing immunotherapy? No. Immunotherapy does not interfere with your lifestyle, except for some biochemical changes. You can continue to eat normal diet. There is no need to change your diet at all. Some say you can take an immuno-boosting diet. In fact, it is important to keep your gut healthy. If your gut is healthy, your immunity will be healthy. The gut controls the immune system. जो भी 33 feet of gut है, उसमें कम से कम 20 फुट तो इंटेस्टाइन है, स्मॉल एंड लार्ज इंटेस्टाइन. उसमें we have the primary source of immunity called Peyer's patches. They are lymphoid follicles which actually meet your gut bacteria. They are regulated by the gut bacteria interacting with whatever food you take. So whatever is that means you need to take plenty of dahi, you need to take plenty of fermented foods, you need to take plenty of vegetables and fruits. This is important when you are taking immunotherapy. Meat, fish, egg, chicken, mutton are not prevented. You can still consume them when you are taking immunotherapy. As long as they are fresh and not preserved meats, it is perfectly all right to take them. How important is cancer screening is in prevention? Yes, of course. It is the most important part because it is the cheapest. It is proven to benefit. It can prevent hundreds of deaths because you can pick up a cancer, cervical cancer, so you can pick it up even before it is a cancer. That means in the pre-cancerous stage itself, oral and cervical cancer can be prevented even before. So there will be another 5 to 10 years before it becomes a cancer, you can pick it up. And if you do a mammogram, you can pick up so tiny a nodule, which is not palpable by your finger. It can be picked up even by a scan. So a mammogram can pick it up. So it is phenomenally good to do it. So when to start screening? Breast cancer, just before menopause occurs, you can start 40, 45 years, you can start and continue it till about 65 years or beyond. Oral cancer, every fellow who is chewing or has chewed tobacco or has smoked tobacco or used it as snuff, you must be screened for oral cancer. Okay, cervical cancer. Any woman who is sexually active, that means she has a living partner with whom she is sexually active. After the age of 35 years, we can start screening for cervical cancer as long as the uterus is intact. Screening tests in India, only 3 screening tests are done for public health because they are cost economical. So we can do for cervical cancer a simple test called viability, that is a visual inspection with the application of acetic acid or iodine. Or you can go a little step further and do a cytology, either a PAP or a liquid-based cytology. The golden principle is actually demonstration of human papilloma virus. So you can do a viral screen also. which is available now as a point of care. That means it just takes 55 minutes to perform the test. On the spot, we can perform and inform the woman. You are perfectly normal, come back after 10 years. What are some early signs and symptoms of cancer? So, unfortunately, the early signs of cancer are not commensurate with the early stage of cancer. So, let us take a tube. Okay. So, this is the circumference of the tube. Until 9/10 of this tube is blocked, यानी कि इतने तक बंद होने तक you won't get any symptoms of difficulty in swallowing, passing stool or indigestion. समझ लिया ना आप? It is so very advanced. That means 9/10 of the tube is closed. Then only you will start getting symptoms. वो भी early symptom है, फिर भी it is too late for you. अगर खून गिर रहा है मुंह में से या सर्वाइकल वेजाइना से या फ्रॉम योर एनस, वो भी लेट है. दैट इज इट इज ऑलरेडी a proliferative growth which is typically in stage 2 or stage 3 before it starts manifesting as a cancer. So the so-called early signs and symptoms of cancer is a myth. There are no early signs and symptoms of specific for cancer. Cancer can mimic any other disease. In fact, there is so much similarity between symptoms of cancer and tuberculosis that many of our cancer patients are treated for undiagnosed tuberculosis for 6 to 8 months. And so we have lost already a chance of diagnosing them early and treating them. So they are already in an advanced stage by the time they come. Which lifestyle factor among tobacco, alcohol, diet, activity has the strongest link to cancer in India based on you? 100%. It is said that over 50% of the adult cancers are caused by tobacco. Absolutely no doubt. And to that, if you add alcohol, diet or inactivity, or as I said, if you don't take a vaccine for human papillomavirus, hepatitis B, you are highly prone for, or you have a promiscuous lifestyle, you have a very high risk of having a cancer. How does stress and mental health contribute to the risk of cancer, risk and progression? Okay. The brain is the principal controller by two mechanisms. One, it regulates all the other endocrine glands in the body. That means the thyroid, the parathyroid, the pancreas, okay, and the testis and the ovary in the body through what it secretes into the blood. So there is a pituitary gland in your body. It is called the master controller or the band master of the orchestra. It controls all the other endocrine glands in the body. So this is for a sustained response in the body. For an immediate response, it gives a command, ek thappad maro ya bhago. Okay, you fight or flight. That is the immediate response. It does through the nerve. So a command bhija deta hai, it will ask the legs to run or the hand to fight back. Teesra hai, this is important. It controls, regulates this. It regulates stress, regulates the inflammatory response in our body. Inflammatory response. So I told you chronic inflammation, जैसा कि खंगड़ी कैंसर के बारे में बताया था, that is from mental stress. So people who are stressed out and mentally cannot relax, if you learn meditation, of course, you will learn how to relax. So that contributes to cancer risk and progression. So there were hundreds and thousands of patients of cancer were divided into two groups, one of whom was taught relaxation through meditation, mental relaxation through meditation, and the other acted as control group after they got cancer and finished their treatment. And we observe very clearly, distinctly, that those who practice meditation and mental relaxation and a stress-free life after their diagnosis of cancer are highly protected from cancer. Absolutely no doubt. So this is our contribution to the world. How to use yoga, how to control your mind. Yoga is not physical posturing. Physical posturing is a very small part of yoga. The major portion is the stepping stone is ultimately it is the ability to control everything else in your body through your mind. You control the autonomic nerves. It is no longer autonomous. It comes under your control. You control the pituitary gland and all its secretion, and so all the endocrine glands. You control stress and the inflammatory response to stress. All three are under the control of the mind. So you control the mind, you can control every other response of your body to any external or internal threat. What are the most effective cancer screening tools available? Only 3 tools. So one is oral examination, second is breast screening through mammography, or at least a clinical breast examination by a healthcare worker or a doctor or a nurse who is well trained, and of course a cervical screening through any of the 3 methods which I have mentioned. Do you see differences in cancer trends among younger populations today due to changing lifestyles? Yes, 100%. We are seeing cancer in younger and younger people. Absolutely no doubt about it. In the past, we used to see that in elderly people. Now we are seeing it younger. So yes, you are right. I have already told you, this is called urbanization. I'm aping the West. I like that. I don't mind you. We are using the Western technology of Zoom conference today. But let me tell you that let it stop at Zoom, and let it not go to aping them in their diet, in their other promiscuity, etc. Please retain your Indian values, Indian cultural values, Indian food habits, Indian way of dressing, and Indian way of cultivating yoga as a part of your life, daily life. Meditation as a part of your daily life are very important to leading a very healthy life. And even if you are deceased, these aspects will continue to protect you, reach your maximal capacity with whatever treatment is available. So any more questions? Did I answer everybody?
Sir, I think we do have more questions.
Okay. Is eating non-vegetarian food linked to higher incidence of cancer? No. I told you it is only processed meats. So if you can avoid fat along with the meat, they are called lean meats. Lean meats. Yes, lean meats are very good for health. Let me put it the other way around. If you go to Greenland, Iceland, or Alaska, you cannot eat a single vegetable. So for the past 5 to 10,000 years, people there have been eating only meat, that is whale meat or fish. They don't have any incidence of cancer. Their incidence of cancer is 0. So I hope I answered your question that eating meat is nothing unsafe as long as it is fresh. I often eat outside packaged food due to a busy schedule. Is that a serious risk? Yes, sir. It is a serious risk. We believe that outside food contains 2 things. One, ये हमने सांबार बनाया, वो पैकेजेस करके स्मॉल पोर्शन करके एक फ्रीजर में डाल दिया, और जब भी एक कस्टमर से ऑर्डर आएगा, पुराना एक सांबार निकाला, एक पैकेज अच्छा सा पैकेज कर दिया, दे दिया. Same thing happens to meat, same thing happens to every dish, same thing happens to idli. And to make it tasty, what makes the food tasty? It is fat. Did you understand what I'm saying? And many of you think ghee is vegetarian. Unfortunately, ghee is an animal product. Okay, so if you understand that it is an animal product, you will never make this mistake of saying, हमने तो ghee ना खाए, animal fat खाया नहीं. Animal fat, your butter and ghee and all paneer are all animal fat only, animal protein only. So don't say that I did not take. In India, we consider them vegetarian. That is different. Okay, so important to understand that as far as possible, avoid the so-called swagruha foods. Okay, and avoid your, is it called Zomato? Yeah, I think Swiggy and Zomato foods, because of their very high fat content and they're preserved. How effective is targeted therapy? Yes, sir. Targeted therapies are effective simply because we are using a molecular switch. I told you there is a genetic switch that I can switch off or block, we call it. So we have a target and we are aiming for the target. The chemotherapy is like police firing. It will kill the cancer cell, but it will also kill all normal cells in the body, like red blood cells, white blood cells, platelets, all the epithelium lining your gut, intestine, etc. All the hair follicles, all of them are lost. So target therapies are phenomenally effective. If I compare it with chemotherapy, in chronic myeloid leukemia, people used to live on an average 18 months. Now we have crossed 24 years. How many years? 24 years of healthy normal life. That is targeted therapies goal. Does using non-stick cookware, plastic container, microwave? Wonderful. Microwaving food does not cause cancer. For microwave, use glassware. Don't use plastic containers. Any plastic. Use glassware. So earthen pots are best, then stone, then glass, then stainless steel. 4 things. Earthen pot, stone, glassware, stainless steel. Of this, the first 3 are brittle. The last one is durable. They are best for human food cooking and eating. Kindly do not use non-stick cookware. There is a coating called Teflon inside. Okay, and Teflon tends to degrade. Maybe some other time I'll talk about plastics. Yes, no plastic container of any sort for storing food. You may use plastic for anything else you want. I'm least bothered. Okay, but for storing food, heating, serving, eating, don't use plastic containers, including a plastic water bottle. Don't use it. In fact, a plastic water bottle is supposed to be discarded, not because somebody else will fill it and give it to you. Plastic leaches into the water. That's the reason why it is asked to be destroyed, not the other way around. You are asked to crush it so that it cannot be reused, because if you reuse it, it actually degrades and gets into the, and all plastics in the body act as estrogen. They are called endocrine disruptors. Should I take supplements, antioxidant? Nothing. All of them are available in your regular food. If you are a non-vegetarian, absolutely no problem about vitamins, calcium, etc. All the vitamins you will get. If you are a vegetarian, B12 is the only problem. So it is important to take fermented foods like idli, dosa, etc. Fermented foods contain enough B12 to give your body. Antioxidants are always available through green leafy vegetables. So if you are a non-vegetarian, you must have fruits and vegetables in your diet. Okay, you don't require any supplements, sir. There is no need. Please suggest cancer prevention steps for sports athletes, because they most of the time traveling and in hotels. Okay, so important part is to cultivate what to eat in a hotel, whether it is fresh. Never ever order chef's special or today's special. Today's special is something which is discarded 1 week or 2 weeks back. Okay, unused, nobody had touched it, and now it is remodified from the freezer, -20 freezer, repurposed and given to you. This is called today's chef's special in a hotel. This is from my own niece who works for the Taj Group of hotels. Okay, so please don't ever order those things. Okay, so sports athletes should be very conversant with what is good diet. You eat plenty of salad. You take plenty of milk and milk products, especially curd. Eat plenty of fruits, and you can have eggs at any time you want. Eggs are easy to, they are made in front of you. An omelette is made in front of you, so you can watch it being made, and you can tell them how much and what oil to use. So yes, you can consume a healthy diet even if you are traveling. Nutrition is sensitive to cancer prevention. There are many diets which you don't require nutritionists. Whatever your grandmother was suggesting you to eat, that it is good for your health, consume that. Not what Zomato or Swiggy is telling you to consume, or the Swagruha Foods is asking you to consume. No. Joby, whatever is very tasty is unhealthy. Cardinal rule is this. So it contains plenty of salt, it is preserved in salt, and plenty of fat. So 2 important things make it unfit for human consumption: salt and fat. Of course, the third one is plenty of sugar. in which it is preserved, especially the colas, soft drinks which you take. Share seminal case study papers relevant to topics mentioned in this lecture. Maybe I will share it with you. You can. Pizza, pani puri, chole bhature, dosa batter are safe. Yes, of course, dosa batter is safe. Chole bhature is excellent. Pani puri, if you know the source of pani and the ingredients in it, and you can make it yourself, you can bring the puri home and make the pani puri at home and enjoy it. No harm in it. Is harmless stuff, I say. Pizza, yes, of course you can eat a pizza, but in moderation. Don't become a pizza addict morning, evening, day, night. You should not be eating pizza. Pizza is, Italian product. So it is a Mediterranean diet. So it is supposed to contain nut meats, plenty of olives, plenty of nuts and fruits. That was the original content along with the cheese on the pizza base. You are adding chicken, mutton, everything has become something. Nirula mein pizza jayega to you will get anything other than it is Indianized pizza. So don't start eating that, Okay. Cancer causing in our environment, water, soil, air, and their derivatives. You can fully control your lifestyle factors. Otherwise, you should become the advocate for that. Meditation alone can't prevent cancer. I know many Swamijis who have got cancer, but they meditated for their own good health, and that helped. But you cannot prevent cancer by following only one road, one pathway. All the 8 are equally important. Okay, each one of them, that is eightfold path, eightfold path, like Buddha taught you. You must follow that. Exercise and cancer, yeah, plenty of them are there. 20s, can I take HPV vaccine? Yes, if you are unmarried, you can take. Is it effective after you are sexually active? Probably not. The best thing then to do would be screening and get your children vaccinated at the right age after they reach 9 years of age. Role of sugar sweets in cancer? It is not sugar which causes the cancer. In fact, cancers don't use sugar at all. They do anaerobic metabolism. So it's a myth. WhatsApp University's myth that sugar causes cancer to flare up. It is completely a myth. It doesn't do anything. Sweet is not the cause. It is the fat which is in the sweet which is important. All our sweets contain 3 ingredients. Egg besan, which is protein. 2, it contains sugar or sugar syrup. 3, it is fried in oil. So a fat, carbohydrate, and protein, all 3 are there. So if you eat sweets in moderation, not excluding your lunch or dinner or breakfast, eat a sweet in moderation. Ek jalebi acha hai, 2 jalebi acha hai. Beyond that, bura hai. Okay, that is important. So it is important to eat everything in moderation. One major challenge is to identify the adulterated food, kalti wala, okay, available in the market. How to do it in our home? Maybe you can take a talk. Last time I did a talk on how to identify adulteration in foods for another different audience. Actually, I did it for Consumer Protection Forum. I did it. Is plastic bottle of light straw water filter product safe? You mean to say one which comes to you through the indoor water purifier? Yes, it is perfectly safe, but not the plastic bottle. You can take it into a glass container, a steel jug or something, and then, or a steel bottle or a copper bottle. Now, only thing, copper bottles need to be cleaned very thoroughly because you get copper sulfate coating inside if you don't clean them very thoroughly. Copper sulfate, of course, is very harmful for health. It is carcinogenic. And locally grown food helps overcome without fertilizer. Of course, organic food is the best. I understand. It's not the fertilizer, sir. It is the insecticide, pesticide, herbicide, larvicide, which happen. We did a big project on that. We did publish it. We wanted to put it on air or write it to the lay press. The government said no. People will start committing suicides because we know our food, especially the urban food, is phenomenally high in pesticide content, and pesticides are carcinogenic. number one carcinogens. Okay, they're good. They're good for killing pests or keeping pests away. But there are many other methods of dealing with pests in the main field, and unfortunately, we should follow them. And it's not a good practice here. Sometime later, maybe if I have another chance, I will talk about pesticides and in food. Okay, that should be fine. Am I right? I have taken all the 28 of them.
Yes, I do see that. I mean, we've exceeded our time
I
again.
understand. We have exceeded our time by 10, 11 minutes.
Yeah, 10, 11 minutes.
Thank you
So
so much. Thank you for giving me this opportunity to talk to you. I hope you enjoyed the talk. Wonderful.
Thank you so much, sir, for such an enlightening and thought-provoking session. I mean, taking us from what is cancer exactly, how we are going to modify our lifestyle, and then giving us like we do not need to use Swiggy and Zomato. I think we all need to work on that. I mean, definitely.
Yes, you need to. You
Yeah.
fast. It is good for health.
Yeah,
Eat
definitely.
food at home. Go to work. Carry something with you. Maybe a banana, an apple,
Yeah.
or a couple of idlis. Eat them when you are hungry. Come home, have a freshly cooked food. That's important.
Yes, so your insights today have been truly like emphasize the power of preventive healthcare and the critical role of our everyday choices that we make in reducing the risk of cancer, from understanding the early warning signs, the screening methods, and embracing the healthier lifestyle habits. And the discussion as is like a valuable reminder for the cancer prevention.
Thank you.
We are also grateful to our wonderful audience for your presence, enthusiasm, and thoughtful questions. Your participation truly brought this session to life. If you found today's session valuable, do share it with your family and friends. Together, we can spread awareness and build a healthier tomorrow. If you have any further question, you can write to us at office@patientsunion.org. Please download the Patients Union app, which is available both on iOS and Android. Until next time, stay well, stay informed, and take care of health. Thank you so much. Thank you so much, sir. Thank you.
सबको मेरा नमस्कार.